All right, today we're tackling a really critical nursing skill: how to safely give medication through a nasogastric tube. For patients who can't swallow, this is literally a lifeline, and getting it right every single time is absolutely non-negotiable.
So this is the big question, right? It's a challenge we face all the time in the clinic, and it demands precision, know-how, and sticking to safety protocols like glue. We're going to break down exactly how you do it, step by step. We've broken this down into 5 clear stages for you. We'll kick things off with the initial checks, then move into prepping the meds. After that, we'll hit the crucial bedside assessment, then the administration itself, and finally, we'll wrap up with aftercare.
Okay, let's dive right in with part 1, the essentials. Before you even think about touching a medication, you have to lay the groundwork. This is all about knowing your patient and the drugs you're about to give, inside and out.
Think of this as your first and maybe most important safety net. It's so much more than just checking a name. You're actually digging into the medication. Can it even be crushed? What are the side effects we need to watch for? You're also doing a quick physical assessment of the abdomen. This context is absolutely vital before you go any further. Okay, with that initial groundwork laid, it's time to head to the prep room. This stage is all about meticulous, careful detail. We're setting ourselves up for success and catching any potential errors before we even get to the patient's bedside. Now, when you're prepping pills, listen up, because this is huge. You crush one pill at a time. Never, ever mix them before crushing. This is all about preventing any weird chemical reactions. Then you dissolve the powder, and here's a great pro tip. Keep that package label right there with the medication cup. That way there's zero confusion about what's inside. And this slide does a great job of showing the difference in technique. With pills, it's all about keeping things separate and clearly labeled. With liquids, it's about precision. Holding the label against your palm, that keeps drips from smudging the name. And reading the meniscus at eye level, that's how you know you have the exact right dose. These little things make a huge difference. All right, we're prepped. Let's head to the patient's room. Now we're at the bedside, and this is our final gateway for all those safety checks. This is where we make absolutely sure we have the right patient and, just as importantly, that the tube is in the right place. At the bedside, just remember these 3 things: identify, position, and explain. First, you identify the patient. Ask their name, check their wristband. Second, you position them in high Fowlers. That just means sitting upright. It helps prevent aspiration. And third, you explain what you're doing. It builds trust and makes the whole process smoother. Okay, this next part, it is the most critical safety check. No exceptions. Before anything goes down that tube, you must confirm it's in the stomach and not the lungs. You do this 3 ways. Check the tube length. Aspirate a little bit of stomach content and test its pH. It should be acidic, 5.5 or less. And always, always double check the most recent X-ray confirmation. You cannot skip these steps. Okay, deep breath. We've checked our patient, our meds, and our tube placement. It's time for the main event, actually giving the medication. Let's walk through the precise rhythm for doing this safely and effectively. And here is the golden rule for administration. Let gravity do the work for you. You'll attach a syringe, but you take the plunger out. Then you pour the medication in and let it flow. You never use the plunger to push it in. Forcing it can create too much pressure and be really uncomfortable for the patient. A nice, gentle flow is always the best way to go. So here's the play-by-play. First, you're going to pinch or clamp that tube to stop anything from backing up. Pour your first dissolved medication into the syringe. Then, unclamp the tube and just let it flow in smoothly. No need to rush it. The second that med is in, what do? You flush. You're going to use about 15 to 30 milliliters of water. And let me be clear, this is not an optional step. It's essential.
And here's why that flush is so non-negotiable. It completely clears the tube of that first medication so it doesn't have a chance to mix with the next one. This stops the tube from clogging, but more importantly, it prevents the drugs from interacting in ways that could make them useless or even harmful.
What this does is create a really simple, powerful rhythm you can follow every single time. It's flush, med, flush. Give the next med, then flush again. You just repeat this cycle for every single medication. It's the core rhythm of the whole procedure. So, you've given the last medication. Awesome. But you're not quite done yet. You do one final flush, again with 15 to 30 milliliters of water. This just makes sure every last bit of medicine is cleared from the tube and has made it to the stomach, where it can do its job. So the meds are in, but our job isn't over, not by a long shot.
Closing the loop on safety is just as crucial as the procedure itself. This is all about making sure the patient is comfortable, our records are perfect, and our assessment continues.
So what's next? You've got 3 equally important priorities right away. 1, make sure your patient is comfortable, with the head of the bed staying up for at least 30 to 60 minutes to prevent any reflux. 2, document everything immediately. And 3, start thinking about evaluation. When are you going to check back to see how the patient is responding?
And here's a really important special consideration you gotta know about. Always be aware of drug-food interactions. If your patient is on a continuous tube feed, some drugs, like phenyletone, don't get absorbed properly with the formula. You'll likely need to pause the feeding for a bit before and after giving the med, so always check your facility's protocol.
So that brings us to our final question. The meds are in, the patient's safe, and you've documented it all. What is your primary job now? Well, the answer is pretty clear, isn't it? It's ongoing assessment. The cycle of care never really stops. You just move into the next phase, which is watching and evaluating your patient's response.